Hello, my name is Samson Lewis, and I will be speaking on behalf of our group, which includes myself and Shumi Shah, Yana Marar, and Juan Carlos de la Guardia. We are facing a never-before-seen pandemic that has killed over 1 million people while decimating far more livelihoods and bankrupting national economies. But today we have positivity. In 2021, Allyria will be afforded a COVID-19 vaccine, and we've put our best minds forward to choose the optimal vaccine option, determine the equitable order of vaccine distribution, and safely and effectively transport, administer, and monitor this vaccine across Allyria. All of this will be done with a central goal in mind. We intend to reduce premature deaths, foster economic stimulation, avoid social instability, and do so in a sustainable manner that will help end community transmission. Without further ado, we have selected our vaccine. Pfizer will provide the sole COVID-19 vaccine used by Allyria. This was a difficult decision, but we have confidence that this vaccine will be the safest, fastest, and most cost-effective option for the Allyrian people. First, the messenger RNA vaccine is safer for high-risk persons. In a pandemic that so disproportionately affects those with pre-existing conditions, we cannot risk live virus options that could further harm those with health problems. Coronaviruses are also prone to mutations, and messenger RNA vaccines are more adaptable than their counterparts. Second, the Pfizer vaccine is developed by joint US, German, and Chinese experts, using protocols and safety measures that we can trust. The costs are transparent and can be afforded. And lastly, this vaccine will save us time and money, vaccinating greater than 80% of the population by the end of 2022, helping us earn herd immunity and costing more than $1 billion less than the Chinese rapid options. And though we have the utmost confidence in our decision, we must mention that no choice was without its detractors. However, the benefits of this choice far outweigh the costs. We will not be joining the COVAX network. We do believe that joining the global vaccine community to help those less fortunate and receive wisdom of crowds benefits are important. But the COVAX options cost far more while simultaneously providing slower, limited distribution to our people. The Pfizer vaccine will also not be available until September 2021. However, Pfizer will make up for this delay with optimal shipment sizes of 3.5 million vaccines per month with a reliable and cost-effective vaccine for Allyria. Lastly, we do recognize that we will have to vaccinate foreign diplomats and expatriates from manufacturing countries first. Yet this is a small price to pay for a trusted, tested vaccine that will save Allyrian lives. But how do we plan on distributing this vaccine? Our team has developed a 4-phase utilitarian distribution strategy, reanalyzing the order provided by the Allyrian government to address our goal of reducing deaths, stimulating the economy, and avoiding social instability and uncertainty. In Phase 1, we will fulfill our obligations to the Pfizer manufacturers and ensure those seeing us through the crisis are protected. In Phase 2, we will avoid premature deaths, providing vaccines to those on the front lines, followed by individuals and communities with high likelihoods of contracting the disease and thus our most prolific spreaders, and our health risk individuals. In Phase 3, we will work to stimulate the economy, vaccinating those that can revive the Allyrian economy, which will effectively bring us to 80% vaccination by the end of 2022 and our desired herd immunity, before we finally enter Phase 4, vaccinating the final 10 million Allyrian citizens by ascending age, ending transmission, and defeating this virus for good. All this distribution will be free to the Allyrian people, sponsored by the state, and done while maintaining strict mask and social distancing policies. This will be a countrywide effort and will require buy-in and clear communication to the Allyrian people in order to be successful. It is also important to note that this phased approach was not developed in a vacuum. This table highlights the cost and vaccination availability benefits of our selection with respect to our distribution order. At its fastest, the Allyrian government will be able to vaccine the first 6 groups included in phases 1 to 3 in 18 months. The Pfizer vaccine will allow Allyria to keep the fastest possible vaccination pace. When compared to other global options we've considered, Pfizer will provide 20 million more vaccines by February 2023, and finally, when compared to the other fastest vaccination options out of China, our option will cost over $1 billion less. So we've articulated our vaccine option and our 4-phase vaccine distribution, but how do we put this strategy into action? Our comprehensive distribution methodology will help divide Allyria to begin simultaneous distribution across the nation. The vaccines must be kept cold and distribution will not be easy. For that reason, we will employ military support and utilize our existing pharmaceutical and vaccine infrastructure to facilitate transport and storage nationwide. All of this will be done with a state-approved lab representative to ensure safe handling of the vaccine at all stages of its distribution. And once the vaccines have safely been transported, they must be administered. Hospitals and health clinics have the best cold storage infrastructure, so we will be using these locations as hubs before administering vaccines at nearby school gyms and publicly accessible spaces. All vaccines will be administered by doctors and registered nurses, and we will be launching a campaign to connect patients to the proper forms to provide their medical history prior to taking the vaccine, and assigning 1-week time slots for each recipient. This will decrease vaccination time on site and ensure state access to people's records for adverse event and second dose tracking. We will also be utilizing an app, email, and call follow-up system to take this tracking effectiveness to the next level. All of this will be done in a newly built IT system that will improve our long-term healthcare infrastructure and will be used to track adverse effects and future doses. In conclusion, the Pfizer vaccine is the safest, fastest, most cost-effective, and economical vaccine, and when paired with our utilitarian 4-phase distribution and implementation plan, will maximize vaccine distribution and minimize premature deaths. All in all, our plan will ensure the long-term health, well-being, and financial stability and prosperity of Allyria. Thank you.